Hello, and welcome to the Quality Insights Practice Module Overview on Screening, Measurement, and Self-Monitoring of Blood Pressure. Today, we will present a high-level overview of evidence-based information related to cardiovascular health and blood pressure management. This work is part of our ongoing efforts in providing Pennsylvania medical practices with information to assist with improving the prevention and management of hypertension, diabetes, and stroke, and is designed to promote and supplement your current quality improvement efforts. All of the content we'll be reviewing today is only a summary of a printable resource produced by Quality Insights in February 2021. You can find the downloadable PDF version of the module by visiting the Quality Insights website, which is linked here as well as at the end of this presentation. Please keep in mind that the various resources in the module are not endorsed by Quality Insights, and that guidelines and recommendations referenced in the module are to be used along with clinician judgment and based on individual patients' unique needs and circumstances. Should you have questions related to the content, please contact your local Quality Insights Practice Transformation Specialist. Recent evidence shows that people with uncontrolled or untreated high blood pressure may be at risk of severe illness with COVID-19. They may also be at greater risk of complications of COVID compared to those whose hypertension is managed with medication. Creating a treatment plan that includes a combination of lifestyle changes, self-management of blood pressure, and medication offers a powerful combination for preventing or reducing the health issues that can be caused by hypertension. Quality Insights is dedicated to assisting your team in achieving optimal blood pressure management during these challenging times. Through our partnership with the Pennsylvania Department of Health, we offer services designed to help you improve and reach your quality improvement goals focused on hypertension, cholesterol, diabetes, and prediabetes. Some of the services offered by Quality Insights include technical assistance to partner with you to achieve clinical quality improvement and value-based care goals. We can also help you gain national recognition for achieving blood pressure management goals. Target BP offers several levels of recognition, including Gold Plus for practices attaining 70% or higher on NQF 18. We also want to point out the link at the bottom of the screen to the Million Hearts Hypertension Control Challenge. In 2021, due to the pandemic, this challenge is not being held. However, we believe that it may be resumed in 2022, and we're watching for more information in the coming months. Be sure that we will share with you any information that we get. Hypertension is a contributing factor for heart disease and stroke, which are the first and fifth leading causes of death in the United States. Nearly 86 million American adults, about 1 in 3, have hypertension. Nearly half of those people do not have their blood pressure under control. In 2019, about 33.3% of Pennsylvania adults reported being told by a healthcare professional that they have high blood pressure. The Surgeon General's Call to Action to Control Hypertension, released in October 2020, seeks to avert the negative health effects of hypertension by identifying evidence-based interventions that can be implemented, adapted, and expanded in diverse settings across the United States. It outlines 3 goals to improve hypertension control across the nation, and each goal is supported by strategies to achieve access. With the support of partners, health professionals, and people like you, the Pennsylvania Department of Health is better able to spread the word about the importance of hypertension control. One of the best first actions to take in hypertension care is beginning the search for patients who may have uncontrolled or undiagnosed hypertension. You can watch the Million Hearts video, Finding Undiagnosed Hypertensive Patients. This 4-minute video linked here explains best practices for finding these at-risk patients in 4 steps using your electronic health record. Out-of-office blood pressure measurements are recommended to confirm the diagnosis of hypertension. Recent research estimates that up to 30% of patients with non-hypertensive in-office blood pressure readings actually have elevated readings when measured outside of the office. This is called masked hypertension. In addition, up to 35% of people with elevated blood pressure in the office may have normal blood pressures when measured outside the office, or white coat hypertension. Self-measured blood pressure monitoring, or SMBP, plus additional clinical support, such as educational classes, one-on-one counseling, and telephonic or web-based support, helps prevent these misclassifications and helps ensure patients are diagnosed more accurately, while improving access and quality of care for individuals with hypertension. You can find more information about the strong scientific evidence supporting SMBP plus clinical support in the Learning module. The Community Preventive Services Task Force recommends team-based care for uncontrolled high blood pressure based on evidence from 80 studies showing that these approaches can increase the number of patients with controlled blood pressure. For more information on ways you can strengthen your care team to provide optimal quality of patient care, visit the CDC's Promoting Team-Based Care to Improve High Blood Pressure Control website and access Quality Insights Care Team Interventions to implement American Heart Association's cardiovascular disease primary prevention guidelines. Accurate measurement of blood pressure is essential both to estimating cardiovascular disease risk and guiding management of high blood pressure. Avoiding common errors can lead to correct diagnoses and speed time to treatment, improving blood pressure control rates. The Learning module offers a sample of resources from the Target BP site that outlines practical approaches to improving blood pressure control for your patients through accurate measurement. As important as it is to ensure accurate blood pressure readings in the clinical setting, the same is true for patients who are collecting measurements at home. Please refer to the Learning module for many resources from Target BP, Million Hearts, and Quality Insights to guide your patients in accurate measurement techniques. Speak to your Quality Insights Practice Transformation Specialist for more information about training your patients in home blood pressure measurement. A 2019 Circulation Research article, Adherence in Hypertension, reports that hypertension is the leading cause of non-communicable disease deaths worldwide. Highlighting the importance of medication adherence in hypertension treatment, the healthcare team is identified as playing a critical role in improving overall adherence to therapy. One great way to begin working toward increased medication adherence in your patients is to utilize the Medication Adherence Estimator. This tool is a patient-centered resource designed to quickly help you gauge a patient's likelihood of adhering to newly prescribed oral medication for certain chronic asymptomatic conditions. You can learn more about the Medication Adherence Estimator and many other resources in Quality Insights Learning module on medication adherence. Are you interested in implementing an SMBP program but concerned about having adequate resources and assistance? Quality Insights offers a free home blood pressure monitor loaner program and training. Participating practices are supplied with up to 5 automated home blood pressure monitors that can be loaned to patients to monitor their BP at home. Loaner monitors are ideal for patients that do not currently own a blood pressure monitor or for those lacking the resources to immediately purchase a device. It may also be useful when a patient is newly diagnosed with hypertension or when a patient experiences a change in medication. Patients and providers are able to track and monitor prehypertensive patients, patients with uncontrolled hypertension, those with changes in hypertension drugs, and patients with recent or past histories of hypertensive crises. Your Quality Insights Practice Transformation Specialist can provide more details about the Home Blood Pressure Monitor program. 2 Pennsylvania medical practices achieved recognition of Million Hearts Hypertension Control Champions in 2019. Dr. Larry Hahn of Stoltz & Hahn Family Medicine of Pinnacle Physicians Group in Trevose credited his success to buy-in from his care team and assistance with EHR technology from Quality Insights. Dr. William Burstein of Philadelphia credits a practice focus on medication adherence and the Quality Insights Home Blood Pressure Monitoring Program for success. Both practices joined an elite group of champions, achieving hypertension control rates of 80% or higher. Million Hearts is a national incentive to prevent 1 million heart attacks and strokes by 2022. As previously noted, due to the challenges faced by healthcare practices in 2020, including COVID-19, there will not be a hypertension control champion program in 2021. However, Quality Insights will continue to work with practices for 2022 eligibility, and we will keep you informed as we learn more in the coming months. You may be interested in learning more about the Million Hearts Hospitals and Health Systems Recognition Program, linked here, which acknowledges institutions working to systematically improve the cardiovascular health of the patients and communities they serve. Living a healthy lifestyle is a focal point of the American College of Cardiology and American Heart Association guideline for the prevention, detection, evaluation, and management of high blood pressure in adults. Lifestyle changes that have been shown to be effective include weight loss, healthy diet, reduced intake of dietary sodium, enhanced intake of dietary potassium, physical activity, and moderation in alcohol intake. You can link to AHA recommended resources shown on the left here, as well as to CDC recommended lifestyle change programs shown on the right. Additional resources are available in the learning module. I hope today's brief overview of the screening, measurement, and self-monitoring of blood pressure learning module has been helpful and that you'll be able to utilize this information in your practice. We invite you to visit the Quality Insights website linked here to download and review all of the available information for this module. Quality Insights also provides a free e-bulletin that features regular updates and resources for cholesterol management, hypertension, prediabetes, and diabetes. Finally, if you have questions or need assistance with implementing quality improvement activities in your practice, a Quality Insights Practice Transformation Specialist is here to help. Please reach out to us at any time. Again, we thank you very much for taking the time to review today's recording. Have a great day.